Monoclonal antibodies are, well, first, antibodies are proteins that are produced by our immune system in response to an infection. A monoclonal antibody is an antibody that's produced by a cell that's specific against a particular virus or bacteria. In the case of COVID, of course, we're talking about COVID. They're basically, a cell is exposed to the virus, then it'll start producing a protein that will attack and kill the virus, or attach to it at least. And so it's synthesized in the lab in that way. Monoclonal antibodies are recommended for people that are 12 years of age or older that are at risk for developing severe disease. So that would be people that have comorbid conditions, diabetes, hypertension, COPD, people that are immunosuppressed or at advanced age, and people that we think are going to potentially get ill with the COVID. People that have not been immunized would be high risk also if they fit the category. With kids, we do recommend that they're at least 40 kilograms or around 88 pounds. The preferred treatment delivery is going to be through the IV infusion, which basically takes about 20 minutes. An IV started, is given through the IV, and we recommend that you get observed and watched for about an hour after that. There are some circumstances that it can be given sub-Q if time is an issue, but the preferred method is going to be IV infusion. Reactions with the monoclonal antibodies are very rare. It can happen. You can have an allergic reaction to the actual antibody, but it's going to be extremely rare, and the sites that are given the infusion are prepared for anything of this sort and have medications we can give if that did occur. However, the odds of it occurring is going to be very, very minimal. The answer is yes. The FDA has kind of put out there that it can be helpful in people that have had positive exposures that are of extreme high risk. That would be people that are in the nursing home, people that are unimmunized, immunosuppressed, and so that is an option that's out there. It really comes down to how quickly you can get a product to the public. With the FDA, to be fully FDA approved, a product has to go through multiple phases of testing. It can take months to years to get to the public, and so sometimes when you have an emergency situation like a pandemic, and a product has been found to be very useful in the treatment, the FDA will basically authorize an emergency use act that will let the product get to the public in a much more quickly and a faster manner. There are other options available outpatient, but primarily it's going to be vitamins. Anybody that we see that even has mild symptoms that test positive for COVID, we recommend to take vitamin D, vitamin C, and zinc. If you end up in the hospital, someone with severe disease, they do have an antiviral they can use for that. And there's an option of convalescent plasma, which is only given in the hospital setting. But outpatient, monoclonal antibodies is going to be the best treatment we have. Yes, even if you've been vaccinated, even if you've been vaccinated for months or even days, you can still get the monoclonal antibodies. Anyone who has the risk of developing severe disease can get it, whether immunized or not. The short answer is 90 days, pretty much. If you've had one round of a two-part vaccine, you pick up COVID and you develop monoclonal, or you get monoclonal antibodies with that, they recommend waiting 90 days before you get your second shot. Now, if you've had no immunization, we would still recommend waiting 90 days before starting your first part of the immunization there. The antibodies are basically synthesized in a lab. They don't come directly from a human. They take a white blood cell or a B lymphocyte, they expose it in the lab to a part of the COVID virus, and then as this B lymphocyte starts producing antibodies, they clone it and they mass produce the antibody that way in the lab.